Hello, my name is Baskovic. I'm an OBGYN here at Providence St. John's Hospital. I like to offer care for women from all walks of life, whether it might be your first pap smear, talking about planning a pregnancy, infertility, and of course going through the journey of the pregnancy itself together. One area that I specialize in is minimally invasive surgery, and specifically that is robotic surgery. Minimally invasive surgery truly is the cutting edge technique available today for women. Some of the great benefits of this type of surgery are, of course, cosmetically smaller incisions. But beyond that, the shorter surgery time, which means less risk to patients, easier recovery. My patients generally walk out of the hospital on the same day of their surgery. They have the comfort of sleeping in their own bed that evening, knowing that they were able to correct the problem that sort of landed you in my office the first place, but doing this in a relatively easy fashion with speedier recovery times is something that I'm so happy to be able to offer, and I think all women can benefit from this type of surgery. Many women that seek my care come to me with large pelvic masses, a history of pain, a history of heavy bleeding, many issues that they've almost made peace with, but have gravely affected their quality of life. They may come and see me for endometriosis, as well as some of the workup perhaps may have already been done, and so we have the diagnoses, whether it's a polyp or fibroids, one or multiple fibroids inside of the uterus, perhaps even a cyst coming from the ovary or the fallopian tube. These are a number of different issues that may require surgical intervention. Once they do come to my office, we oftentimes order the appropriate imaging, workup, and then really sit down together and come up with a plan in order to find the right fit. We go through step by step what the surgery entails, what the recovery looks like, and what outcome that we can expect at the end of all of this. Some of the other issues that women see me for oftentimes are difficulty with getting pregnant or perhaps even having multiple miscarriages. I generally welcome a longer appointment. We sit down together. I have your partners join as well, and we really go through step by step what you've been through and what we can do to hopefully change that outcome moving forward. Here at the Women's Health Institute, we employ a multidisciplinary approach to women's care. From my standpoint, I always like to take a step back and take a whole body approach with my patients. Oftentimes we may come in with one or two or even an accumulation of symptoms, but really there's, a bigger picture at play here. How does this affect the rest of your body? How does this affect your quality of life? And so I always like to start out our visits by really addressing that issue, because it really then helps us along the way tailor a plan that's customized to you. And no two patients, no two women really have the exact same experience. And so I truly believe that every woman needs a tailor-made plan in their care approach. Oftentimes we may have been given diagnoses or discussed a surgical plan, and you still have questions, there are concerns. I always say, why not get a second opinion? I'm always happy to see you in my office for that as well. Talk about perhaps maybe there's a different approach. And oftentimes, even if it's hearing the same thing twice or being able to ask additional questions provides an additional level of comfort as well. There's so many instances where women come to see me where they have been told they need these very large, extravagant surgeries that require prolonged, perhaps hospitalization or recovery. And they come to my office and we kind of talk about it in detail and realize that perhaps they are a candidate for a more minimally invasive approach, a faster recovery time. And even more importantly than all of that, we're able to discuss all of their concerns, address their questions. And so when they do finally make that decision to proceed with surgery, they're doing that with the utmost confidence in not just themselves, but as well as the provider. If you've had questions about your symptoms, questions about even diagnoses you may have had in the past, come make an appointment with me. We can sit down and talk about it. We can sort of start from the beginning, see everything that's been done, go into it in detail, and then help to either carry on a plan that's in place or formulate a new plan that might be more applicable to you specifically. I'm able to offer this in my office or virtually, whatever works better for you.